Hi, Joanne.
Oh, good morning, Barbara.
Good morning.
It's great to see you. How's everything been going this month?
Just great. I have everything under control now, and I am feeling better.
Well, you look terrific, so your diabetes treatment plan appears to agree with you.
Well, as long as I take my medication, stick to my diet, and get plenty of exercise, my blood glucose levels stay very close to normal.
Well, great. So you're monitoring frequently. How often?
Well, I bought the SureStep system you told me about. I use it at least 2 times a day and sometimes as much as 4. You asked me to bring it along today.
Great. I thought we could use our time today to review your testing technique, make sure you're on the right track, and answer any questions you may have.
Well, I have everything here. My owner's booklet, which I've already read through, and this quick reference guide, which I keep with me, my logbook, the Penlet Plus sampler, my SureStep meter and test strips, sterile Lancets, and SureStep glucose control solution.
Is the SureStep system working for you? Any problems?
I can't believe how easy it is to use. The SureStep system helps my testing every step of the way. It's perfectly easy to do what I have to do.
I recommend the SureStep system to most of my patients because it's so easy to use. Let's do a quick review of the test procedure, and then we'll have you do a test yourself. Apply a drop of blood to the pink test square on the front of the SureStep test strip. You can either dab the test strip to the finger or drop the blood to the test strip, whichever is easiest. That's what's so nice about a test strip that you can touch. Then you turn the test strip over to check that the confirmation dot on the back has turned completely blue. It tells you that you've applied enough blood, so you can be confident in your test results. You insert the test strip into the meter. The test is so quick, it averages about 30 seconds before the test result appears on the display with the time and then the date of the test. Now it's your turn.
I used my last test strip this morning, so I'll have to open up a new package.
Let's check the expiration date on the test strip package. Test strips must be discarded 4 months after opening, so we'll write the discard date on the label. Remember, test strips are sensitive to heat and moisture, so be sure to take the following precautions. Keep your test strips only in the bottle they came in and store them in a cool, dry place. Close the bottle tightly after use. Use only SureStep test strips made by LifeScan. All right, let's do that test. What do we need to do first?
Code the meter to the test strips.
That's right. Code numbers are used to calibrate the SureStep test strips with the SureStep meter for accurate results. The first time you use the meter and every time you change to a new package of test strips, you need to make sure the code number on the display matches the code number on the test strip package.
What happens if I forget?
You may get inaccurate test results from the meter, so this is very important. Start by pressing the blue power button to turn on the meter.
My last blood glucose result appears on the display.
It could also be a control solution result if that was the last test you did.
Next, the meter code will appear for a few seconds.
The code number on the test strip package ranges from 1 to 21.
If the code number on the display matches the code number on the test strip package, I can begin testing. If the 2 code numbers do not match, then I can change the code number when I see the word code. Then I press the C button until the 2 code numbers match. Now I'm ready to do a blood test.
Well, not quite. We've opened a new package of test strips. We should do a control solution test first.
Oh, you're right.
The meter performs an automatic check every time you turn it on. If there's a problem with the meter, an error message will appear on the display. Control Solution enables you to check your SureStep blood glucose monitoring system to help assure proper results. You should do a Control Solution test before testing with the SureStep meter for the first time. Also, every time you open a new package of test strips, as we just did. You should also do a control solution test whenever you suspect the meter or test strips are not working properly, when your test results do not reflect how you feel, or if you should drop the meter. Make sure that you use only SureStep glucose control solution to check the system. Find the expiration date. Discard the vial 3 months after opening it. Write the discard date on the vial and do not use it after that date. Turn the meter on and check that the code numbers match. Shake the vial gently. Then apply a drop of control solution directly onto the pink test square. Turn the test strip over to see that the confirmation dot on the back has turned completely blue, telling you that you have applied enough control solution. Insert the test strip, pink side up, firmly into the meter until it stops. The control solution test result appears in about 30 seconds. Remember to mark it as a control solution test so that it will be stored that way in the meter memory. Push the C button while the test result is on the display. CTL will appear on the display and be stored in the meter memory with the test result. It will not be included in your 14 and 30-day blood glucose averages. If the control solution test result displayed on the meter is within the range shown on the SureStep test strip package, then you are ready to test your blood.
I haven't had one out of range yet.
Well, if you do, repeat the test. If the second test is out of range, the reasons may include an error in the way you performed the test, expired or contaminated control solution, failure to code the meter properly, a dirty meter or test strip holder, deteriorated test strips, a meter malfunction, or using control solution outside the range of 59 to 95 degrees Fahrenheit. In any event, whenever you have a problem with your meter, follow the instructions in your owner's booklet. Now it's time to do that blood glucose test. The Penlet Plus adjustable blood sampler allows you to adjust the depth of the puncture you make with a finger stick. Let's set the control knob at medium to start. That does it. These fine point lancets are great, aren't they?
They sure are. Now I have everything I need to test in front of me. I have my SureStep meter, my Penlet Plus sampler, a sterile fine point lancet, and SureStep test strips.
Getting a drop of blood is one of the most important steps in getting an accurate test result. Each time you test, use a new sterile lancet. Do not use a lancet if the protective disc has been removed or damaged. And of course, never use a lancet that someone else has used. Twist the Penlet Plus cap counterclockwise to remove it. Insert a new sterile lancet into the lancet holder. Push firmly until the lancet is securely seated. Twist off the protective disc, then replace the Penlet Plus cap. Be careful not to tighten it too much. Cock the Penlet Plus sampler and it's ready to use.
First, I'm going to wash my hands. It's important to wash your hands with soap and warm water to make sure they're clean, but also because warm water stimulates blood flow to the fingers. Now that my hands are nice and dry, I let my arm hang down for several seconds.
You do rotate the finger sticks around to your other fingers.
Oh yeah, I choose a different spot on the side of the finger every time so I avoid soreness or calluses in any one spot. Next, I remove a test strip from the vial and compare the confirmation dot on the back of the test strip to the color chart on the vial. If it looks like the color marked unused, I'm ready to go. I also check to be sure the test strip is not bent, torn, or damaged in any way. Now I hold the sampler firmly against the side of my finger and press the button. Holding my hand down, I gently squeeze the finger. I apply a drop of blood to the center of the pink test square. I can dab or smear the blood onto the test strip like this, or I can drop the blood to the test strip like this. Either way you do it, the blood is quickly absorbed into the pink test square. After a few seconds, I look at the confirmation dot on the back. If it's completely blue, I can go on. A confirmation dot with white patches or streaks means there's not enough blood. If this happens, I start over with a new test strip. If the whole white portion of the pad has been soaked, I also have to start over. Now I slide the test strip into the test strip holder, pink side up. I push it in firmly until it stops. I have up to 2 minutes after applying blood to insert the test strip. The test takes an average of 30 seconds. The flashing clock symbol means the meter is reading my test. 3 short beeps and my test result with the time and date is displayed. If my result doesn't seem to agree with how I feel, I redo the test or follow the testing tips listed in the owner's booklet. This test result is right in my range.
Let's do a quick review of the display symbols and what they mean. Just one of the reasons I recommend the SureStep meter is that it uses symbols on the display to take you through the test and give you helpful messages. When you push and hold down the blue power button, the display shows you all the symbols that can give you important messages. Let's look at how these symbols help you do the test properly. When you turn on the meter, your last test result appears on the display. This memory symbol tells you the result is from memory. This symbol tells you when to apply blood to the test strip. This one signals when and how to put the test strip into the meter. It goes pink side up, white tip first. Push it in firmly until it stops. If the meter senses that you haven't inserted the test strip far enough, it tells you with this symbol. And if you remove it too early, this symbol appears. The flashing clock tells you to wait for a test result. If you get this message, it means that your test result is over 500 milligrams per deciliter. If you have symptoms that match this result, call your healthcare professional immediately. An error message appears as ER plus a number from 1 through 6. This could happen during the test procedure if the meter detects an error. Each error message can have multiple meanings. A complete list and what to do if you get an error message can be found in the owner's booklet. Now there's just one other symbol. That's the one that looks like a cotton swab. It appears with the error message ER5, and it tells you to clean the meter. Let's talk for a moment about the meter memory. The SureStep meter stores 150 blood glucose and control solution tests in its memory, along with the times and dates you performed the tests. Now, if you want to review your previous test results, press the power button and hold it for 5 seconds. When the display flashes, release the power button. You are now in the memory mode. The first number that appears is an average of your blood glucose tests over the past 14 calendar days. Press the C button and a 30-day average appears. Then, each time you press and release the C button, the meter will recall up to your last 150 test results with date and time in order. Control solution tests are marked CTL. And if a previous test resulted in an error condition, the error will be stored in the memory with the date. Don't wait for the message that tells you to clean the meter. Check the meter regularly to see if it needs cleaning. If you notice any dirt, blood, or lint on it, clean it.
Oh, right, I do. First, I remove the test strip holder by pressing down on the top end and sliding it away. Then I wash the test strip holder with a soft cloth dampened with water. I never use ammonia or anything with ammonia in it like Windex and other glass cleaners because they can damage the meter. I open it up and gently wipe all of the surfaces free of any debris, and then dry. I dry it completely with a soft, lint-free cloth or tissue. I clean the lens area and contact points with a damp cotton swab or soft cloth. I never use abrasive materials like paper towels that will scratch the lens, and I don't use anything that would leave lint, lotion, or perfume on it. Now I slide the test strip holder back into the meter and press down on the top until I hear a click. When I need to disinfect the meter, I use a solution of 10% bleach and 90% water, but I make sure that I completely remove any bleach residue with a damp cloth. Bleach will react with the test strips and cause false results.
Very good, Barbara. You have your whole routine together. There's just one more area we should cover before I let you go, and that's changing meter settings. Here's a summary of all the meter settings you can change. The meter is set at the factory to Pacific Standard Time, but you can change it to any time zone and adjust the date too. The automatic display of your last test result is turned on, but you can turn it off. You can keep the unit of measurement in milligrams per deciliter or change it to millimoles per liter. You can keep the beep signals on during testing or turn them off. The meter is set to display the 14 and 30-day averages when you enter memory mode, but you can turn these off as well. You can change the time format from AM/PM to 24-hour time. And finally, you can change the date format from month-day to day-month. To change meter settings, you must put the meter into setup mode. To enter setup mode, first make sure the meter is off. Then, press and hold down the green C button. Continue holding the C button while you press and release the blue power button. Then release the C button. Each setting will flash on the display until you press the power button to move to the next feature. To move quickly through the features, press the power button repeatedly, or press and hold it to scroll. With the hour flashing, each press of the C button will advance the time 1 hour. Now that I have the correct hour, I press the power button and the minutes will flash. Again, I use the C button to change the setting and the power button to move to the next setting. Now, to exit the setup mode, I simply press and hold the power button until the display is blank. Complete information on every setting may be found in the owner's booklet. Through regular monitoring, you can get better control of your diabetes. The SureStep blood glucose monitoring system from LifeScan makes it perfectly easy at every step in the test procedure. It gives you some flexibility on blood application technique, helps confirm when enough blood has been applied to the test strip, and gives you results on a large, easy-to-read display. And with a big 150 test memory, date and time, and 14 and 30-day averages, it's simple to track how you're doing. Did you have any questions, Barbara?
Not that I can think of right now, but I know if I do, I can generally find the answer in my SureStep owner's booklet, or I can call LifeScan Customer Services at 1-800-227-8862. There's always someone there to help, 24 hours a day, 7 days a week.